button to start us now. And we're going live. And you are live, Councillor Clements.
Good evening, everybody. My name's Councillor Liz Clements, and I'm here with my colleague Councillor Fred Grindrod. We are the ward councillors for Bournville and Cotteridge. I'm very pleased to be able to welcome everyone to this online meeting, ward meeting for Bournville and Cotteridge ward. It's the first time we've met since our last meeting, which was in March 2020. So I'm very grateful to the council officers and our IT section who facilitated this online session. So welcome to residents and partners who are dialing in and participating in this meeting. It's interesting to reflect on the last 6 months. We've had a fantastic community response to the COVID pandemic in our neighbourhoods, and I can only congratulate and thank all the people who've pulled together to provide food for people in need through food banks and food deliveries. There's been fantastic effort and befriending services, street champions, lots of work coordinated by local churches, by the Bournville Hub and by community groups across our whole area. So just thank you, from the bottom of our hearts to everybody who's contributed. And it's obviously going to be a difficult autumn and winter, but that community solidarity we've had has been a real pleasure to behold. This evening, we've got two really important items. We've got an update from our public health consultant, Dino Motti, who'll be talking to us about the current COVID pandemic, and then we'll be moving on to talk about the council's COVID emergency transport response and the work on places for people in B30 in our ward. And we've got Joe Green and colleagues from Sustrans to talk to us. So I'd like to move on now and invite Dino to talk to us about the current COVID pandemic and the work that the public health team are doing across the city. And he'll be happy to take questions afterwards. Dino.
Thank you, Councillor Clement. Just to correct, I am a public health registrar at Birmingham City Council, not a consultant yet. And I'm here I'm replacing the Director of Public Health, Justin Varney, who is in another meeting at the moment. The history of this COVID pandemic is known to us all, but it's good to recap from the beginning. The coronavirus that is at the source of this pandemic has been known from December. It then reached the UK sometime in the following year, and maybe through China, maybe through Italy, has reached the UK, and we have seen the first wave hit the country earlier this year from March on, with all the lockdown and limitations that we've all experienced and endured. We have benefited from the effects of these measures throughout the summer, but now unfortunately we are seeing a resurgence of the virus, and Birmingham has reached now a rate of infection of 145 over 100,000, which basically means we have 1,600 cases a day of the virus to contend with. This has put Birmingham into the high risk tier, which is the middle tier of the three that the government has defined. And this also means that there have been new restrictions imposed in order to reduce the spread. We've seen that the spread is being driven this time mainly by the younger age groups. And as you might have seen in the national updates by the government advisors, we see a progressive spread from the younger age groups into older and older age groups. And that is what we're trying to address, especially because we've seen that the spread happens between when households meet. And so the measures are all focused on reducing that inter-household meeting, which is not allowed anymore indoors. In outdoors, the rule of 6 still applies. So outdoors, you cannot meet more than 6 people. And that it still encompasses all indoor venues, so including pubs and other venues. So not just houses. So indoor, you cannot meet anybody from outside your household, or obviously that includes people you're bubbling up. So obviously if you have a bubble, that doesn't apply. What I would like to speak, and I'm just using Justin Varney's word, the DPH words, would like to pass a message on what are the risk factors and what you can do to mitigate those risk factors. So we know from the evidence that has emerged during these early stages of this pandemic, the risk factors involve age, involve the sex. Unfortunately, men have higher likelihood to get adverse effects and more severe disease than women. This is due to a variety of other factors that we haven't yet got to the bottom of. It could include smoking, could include a higher incidence of obesity and other chronic conditions. And chronic conditions are another factor, which are again aligned sometimes with ethnicity, sometimes with sex. So there is an interplay of different factors. What we can do is reduce smoking, which is known to be associated with severe effects. We can work on reducing our body mass. Obesity is known to have a big impact on the severity of the disease that we develop. We can work on other chronic conditions like diabetes, which again, if well controlled, have shown to be, let's say, leading to better outcomes rather than poorly controlled chronic conditions. And we can also take the flu vaccine. Recent data from Australia has shown that having the flu at the same time as COVID is making it worse. So it's more likely that if you have the flu and COVID, and you can have them both at the same time, as Australia has shown, they are in the other season, let's say, compared to us, they've already gone through the winter. We are more likely to see a person going to ITU and having severe effect and higher mortality, unfortunately. So getting vaccinated for the flu is something we can all do to protect ourselves and protect others from a virus that can be a co-infection with COVID and make matters even worse. In terms of testing, another clear message is that if we develop symptoms, and by symptoms we mean a high temperature, a new onset of cough, or a loss of taste and smell, we should first isolate and then get tested. And that in that sequence. So we should not wait for a test result to isolate. We have the symptoms, we isolate, then we get tested. And we can get tested via accessing the website, where we can look at where a drive-in, a walk-in, or a postal kit can be requested, or by calling the number 119, which again allows us to access these services. We've also seen in previous Word Forums questions about antibody testings. I'll just preempt that question by saying that at the moment that is a kind of test that is not very useful for the general population. It's only used for NHS staff and patients that are admitted to hospital. It doesn't really give you much of an indication, and spending money, and it can cost more than £100 on this kind of test, is not necessarily useful. It's not useful at all, in the sense that many people don't develop antibodies. Many people do not keep their antibodies long, and many people have antibodies that are not effective. So even if you get a test that is able to show them, it is not necessarily something that you can benefit from in terms of information. The measures to control this virus, we've heard them, but it's good to repeat them. It means keeping a distance above 2 meters from each other, washing the hands regularly, especially when we touch surfaces, and we do not touch our face with our hands before having washed them. That is very important. Another thing that we have to know, especially if we have some symptoms, is to pay attention to touch surfaces. Let's not touch handles and buttons when we have sneezed on our hands and before washing them. If we have necessarily with symptoms to go out, let's use another implement to touch a handle so we can protect others from catching the virus that we might be spreading unwittingly after having sneezed on our hands. And a mask worn nose to chin every time we go indoor or every time we enter a vehicle, be it a taxi, a train, or a bus. That is very important because, again, in an enclosed space, the virus can linger or be more concentrated from the passage of other people. Another thing that we can do, and we just had a chat with the council about it, is joining the community champions, which is an initiative that the council has put in place. You can find information online, which will keep you in the loop and will give you a role and information to play in your community. in maintaining also good practices among the community, and also you will have access to seminars and tips on COVID and up-to-date information and data, which is something that we all can do, and it's an important way to share information across the population. Yeah, we're definitely approaching the second wave. As I said, we're in the tier 2 of the 3, and I just repeat the changes for Birmingham, and that no meetings indoor between households is in addition to the rule of 6, which means that it also applies to private gardens, both inside and outside the city borders. But for more specific information, I remind you to the council website and to the government website, which is a very long list of specific circumstances, which I cannot now go through with several pages. But if you have a specific question about your specific circumstances, from the council website, there is a link directly from the COVID section to the government indications on this new high-risk denomination. We also have a Be Healthy booklet, which is very important, especially for our communities where English is not the most spoken language. It's translated in several languages, and it contains a wealth of information on COVID, which is very useful if you want to know more, or if you want to help your community learn about COVID and what to do in order to prevent the spread. Otherwise, I think I have covered everything I wanted to say. If there are any questions, I'm very happy to take them. Thank you.
Thanks very much, Dino. That was very comprehensive, and I think very reassuring for us all. And again, you referred to the Community Champion Scheme, and I've just joined that myself. And I think it's, you can engage with it at various levels, but at its lowest level, I think you will receive regular information by email or by text message, by whichever method is best for you, which will give you up-to-date statistics about the prevalence in our communities and public health measures and other things that you can get involved in. And I think it's really what you feel comfortable with. At this point, I'm just going to ask our committee manager, Kay. I'm not seeing any questions in the Q&A box. Is that right, or is my system slow?
No, you're right, Councillor Clements. We haven't got any questions for Dino. He's obviously covered everything.
Yes, that shows what the expertise. When if in that case, I may abuse the chair by asking a question, and I'm sure Fred may have some questions as well. One of the things that's on my mind is that the fact that actually, as far as I know, that the incidence in the areas that surround our universities in the city is higher. So I wonder whether you can provide us with some reassurance about the measures, that the public health measures that are being taken by the various universities across the city. Are they adequate to prevent the spread of transmission to the wider community?
Am I okay? Now it's. Yes, as I said, the epidemiological data that we have seems to indicate that driving the infection this time round, it's younger age groups, in the sense that it's ages that are usually at university. And so we have seen a concentration of cases among university students in university accommodation or in student accommodation areas of the city. We are testing these cases, and we are isolating. We're asking universities in particular to isolate students in residences. The measures that we have are those that we have listed. So they are measures of testing and isolating and quarantining contacts in order for the spread to stop. And the measures that are being implemented now in Birmingham will also help towards that, in the sense that they will again reduce inter-household mixing. We've also done some targeted testing in student accommodation within University of Birmingham in particular. And we're also conducting door-to-door testing in student areas in the city, which will allow us to reach those cases earlier than otherwise with a regular driving testing. Obviously, we don't expect students to have a car, and therefore they are those populations that we're targeting with this service in order to offer testing closer to home and reduce the time for the results to come back. we are putting everything we can on this and trying to obviously reduce the spread to other age groups and other parts of the city. It is obviously a very tough challenge, but we are doing what very few other cities are doing in this respect, and Birmingham is getting its fair share of test kits, so we don't have that sort of issue. I am not sure if I answered your question fully. If you have any follow-up.
No, that's fine. That was a very helpful answer. And I'm turned on BBC WM earlier today, and I heard Dr. Justin Varney, he's your colleague, our Director of Public Health, being interviewed, and he was saying that in contrast to some other parts of the country, at the moment, I think that the difficulties that people were having in accessing tests in Birmingham, those have actually quietened down quite a lot, and it's actually the supply of tests is adequate at the moment, so that your encouragement for people to come forward for tests as soon as they've got symptoms is very important, isn't it? That you shouldn't delay and get tested as soon as possible. Just if I may ask another question, in terms of casework inquiries that I've had from constituents, I've had people inquiring about whether, if they are in a situation where they're providing care to a vulnerable older relative, say someone living on their own, are they able to carry on doing that within the higher tier restrictions that we're now under?
Sorry, am I okay? I am now. Sorry, I have to wait a little bit for the live to come on. It depends, in the sense that I haven't got the detail of every single situation, and these situations have to be looked at individually. But if somebody is bubbling up or has caring responsibility for someone else, they can look after that person. But again, that person is a vulnerable individual, and so again, it's very important to make sure that everything is done to reduce their exposure to the virus, and we could be unwitting carriers, so we have to pay extreme attention to all of those measures that we said before. So wearing a mask indoor, cleaning surfaces, washing hands, and isolating or isolating if we have symptoms, and quarantining if we are in contact with somebody who had symptoms or a positive test.
Thanks, Dino. Yes, that's a very important reminder that we all need to act as though we could all have it, and anyone could have it. So being aware of the risk of asymptomatic transmission, I believe it's called, is important. Yeah. So for the need to wear face masks, wash hands, and maintain the social distancing. Councillor Grindrod's got a question now. Fred, over to you.
Yeah, thanks, Liz. Thanks, Dino, for that presentation. One of the questions that I think has come up to me separately is the confusion between what was the difference between yesterday, Tuesday, and today, Wednesday, in terms of the government's restrictions, particularly with regard to cafes. So I've been a local cafe owner has been in touch with us about whether people can still, from different households, can meet outside in the cafe area outdoors. Obviously, no mixing indoors anymore. But is it still possible, if your cafe's got a good, well-spaced garden, to meet up with other households? And then the other question that had come through on the chat was just repeating the advice for meetings in private gardens. So I guess in one sense that's the opposite of my other question, is that yesterday it wasn't possible for households to meet in private gardens, but the government advice seems to indicate that now it is. Would you be able to just re-clarify that for us?
As far as I understood the guidance, indoor we cannot meet across households, and that is the new regulation. Outdoors we can meet up to 6 people, and that is the rule of 6. In terms of the specific pub that we're talking about, it does depend. I would have to look exactly at what the circumstances are there, because indoor or outdoor, it's a question that has to be looked at. But indeed, it's the guidance on the website says that venues following COVID secure guidance can host more people in total, but no one must mix indoor with outdoors. You can meet in group of up to 6 people. This includes in pubs and restaurants, shops, leisure entertainment venues, places of worship. And this is the wording of the guidance.
Thanks, Dino. That's great. I think what it does, as you say, it's about getting to grips with that definition of indoor and outdoor. So I think it might be useful feeding that back, into our advice as a council as to how, because I know that a lot of kind of cafe owners who've put a lot of effort into making sure that their venues are COVID secure, both indoors and outdoors, recognise that indoors is no longer possible, but outdoors, could be possible, but it might not be. So we need to kind of get some clarity and advice on that. Thanks, Dino. Really appreciate that. If there
is any ambiguity, let's absolutely address it.
And I think the thing that's different from Tuesday to Wednesday is that it's now possible to meet in gardens, isn't it? I think that seemed to be the main difference, but within the other restrictions, the rule of 6. But again, I think Dino's right to say look at the written guidance. Do you want to come back in there, Dino? I've just noticed
So this, I'm just saying that this will apply to private gardens as well. So you cannot meet with households in a private garden. So it's different. So mixing households in a private garden is not allowed, as you said.
Okay. So I think it's important that people actually look online via the links that you've suggested to check out the written guidance. I'm just seeing in there the question and answer, a question from Andrew Nixon, who's one of our residents in Cotteridge. Hello, Andrew. I've seen your question, and it's he's asking whether Dino's got any comments about the incident that happened in Selly Oak today. It's been widely reported, which was about, I think, the mistaken distribution of packs that had been used. I mean, again, that's why I happened to hear Justin Varney speaking earlier. But sorry, I don't want to put you on the spot there, Dino, but do you have any comments about that?
I still haven't seen the latest data on the accident, so I stand by what Justin Varney has declared to the media. And obviously, as Birmingham City Council, we're doing everything we can to get to the bottom of this and make sure it doesn't happen again.
I mean, if I could just stop me if any of this is going beyond what we know to be the situation, but what I heard in the interview with Dr. Varney gave to BBC WN earlier in the day was that, that the incident was discovered. It's obviously a very serious incident, but it was discovered within 10 minutes or so of the wrong swab, or the used swabs being distributed on I think it was Tiverton Road in Bournville, and action was taken very quickly to address this, and there's now a root and branch review of the whole system. But it's clearly a very, very serious incident. So I'm sure that there are official media statements from Dr. Varney and the City Council corporately. So I hope that answers your question, Andrew. And if you check on the council's website for any further statements about it. Don't know whether you want to add anything, Dino.
No, thank you.
Not at this stage.
It's exactly what you said. I mean, it's clearly a serious incident. We're taking it very seriously, but it was caught very quickly, and now there is a root and branch review of exactly the dynamic to understand how it happened and make sure that it does not happen again.
Thank you very much. Just saying that that Dino's here and happy to answer any questions. So please post questions in the chat. So Andrew's just posted. Thank you through me. Thank you, Dino, through the chair. And apologies for raising this, but it's had a lot of coverage in the media today, some of which has been negative for the city. And obviously, we want to ensure that people have the easiest possible access to testing. So particularly for students where they may have don't have transport and may find it more difficult. That was the point of having that the drop and collect service in local neighbourhoods. But thanks for your answers on that. So in the absence of any further questions, I'd like to then just thank Dino for being with us this evening and stepping in to cover this local meeting at very short notice. And it's been a pleasure to have you with us, and thank you for your very comprehensive and clear presentation and your openness to answering these questions. And thank you very much. So we'll be moving on to our next item, but great to have you with us. And can I just say from the chair that at the beginning I committed a slight blunder, because I should have said at the beginning that this meeting is being recorded and that recording will be made available as the record of the meeting. So that's what we will have in lieu of minutes for this session. So if anyone wants to see Dino's presentation again, it will be available. Okay, so we're now going to move on to our discussion of the COVID emergency transport response and the Bournville and B30 Places for People initiatives that are going on in our ward. And I'm very pleased that we've got Joe Green from the council to talk to us about this, and also Rigi Calaria from Sustrans. So over to you, Joe, and I believe you're going to talk to us, but also show us a few slides as well to set the scene.
Thank you, Councillor Clements. Yeah, good evening, everyone. I do have a few slides, although I'm trying to keep it sort of minimal. There we go. If people are after further details, then on the Places for People website within the Birmingham City Council pages, there is a presentation and recording from a briefing session we delivered a few weeks ago, which goes into more detail. But yeah, just 10 minutes, sort of give a brief overview of the Places for People programme and what's currently being brought forward in Bournville as part of this, as well as some upcoming opportunities, and then very happy to take sort of questions and have further discussion around that. I believe at the start of the meeting it was mentioned that the last ward forum was back in March, just prior to lockdown, and at that the Birmingham Transport Plan consultation was on the agenda. That's right, yeah. Does seem like quite a while ago now, but earlier this year we launched a draft transport plan for the city. It was structured around 4 big moves. One of those was around prioritising active travel in local neighbourhoods, and what this big move looks to do is enable walking and cycling to become the way that most people get around their local area most of the time, so that cars no longer dominate sort of street life, and residential areas are places where people are put first. So this includes 20-mile-per-hour speed limits, school street measures such as we currently have at St Francis, and also developing places for people or low traffic neighbourhoods. Obviously quite a bit has changed since then, and in May we published an emergency transport plan based on the same vision and big moves as the draft transport plan, but repurposing a lot of that to the new challenges and the new environment in which we're operating. This was looking to ensure that people have safe space for walking and cycling, but also to accommodate social distancing. Within the emergency transport plan, we committed to deliver 2 low traffic neighbourhood pilots, as well as progressing some measures in other parts of the city, and looking at how we can roll this out across the whole of Birmingham. And the way in which we've done that in Birmingham is to create this new Places for People programme. As mentioned in that big move, it's about ensuring local areas are places that people are put first, where it feels safe to walk, cycle, play, socialise, where there's cleaner air, it's a quieter environment, it's a safer environment, and it's kind of going back to what a lot of people commented about during lockdown, how the streets around where they live felt, and the main reason for that is because there was less traffic. So as part of the emergency transport plan, how do we try to develop low traffic neighbourhoods? It may be a new concept or a new term for some people, but it is something that's been developed for a number of years in various countries and in various parts of the UK, particularly in London, and it's something that we're very keen to bring forward across Birmingham. Low traffic neighbourhoods are groups of residential streets where through trips or cut-throughs by motor vehicles are discouraged or prevented. However, residents are still able to drive onto their street, have visitors, get deliveries, go to and from where they currently do, just sometimes by different routes. Alongside that, we're also looking to reduce traffic on surrounding streets, on main roads, provide safer crossings and cycle infrastructure. And what we're hoping to achieve by this is a nicer, quieter, safer environment for everyone. And this isn't just something that we're looking to do in isolation in Birmingham. This is something that the government have highlighted. They recently published a new walking and cycling plan, gear change, and low traffic neighbourhoods were mentioned in this as one way in which councils can encourage more walking and cycling. As I say, it is still possible to access anywhere that you currently do, but what you can't do is use roads as through routes or cut throughs, and that this is looking to reduce accidents, pollution, noise, etc. And the good news, I guess, is that we've actually had some funding to support this, and fingers crossed there will be some further funding very soon to further develop. So back in, I think it was June, the Department for Transport announced the Emergency Active Travel Fund. This was part of a £2 billion package for walking and cycling, and £250 million was being released to local councils this financial year. The guidance from the government was very clear in terms of how this should be used, that it was for sort of temporary interventions to ensure a safer environment for walking and cycling, but that local authorities were sort of challenged almost to bring forward swift and meaningful plans that reallocate road space, really sort of change the existing arrangement on our streets. And one way that they highlighted as being able to deliver this is point or road closures that can be used to create low traffic neighbourhoods. The Emergency Active Travel Fund is being released in two tranches or rounds of funding. We're currently just completing the delivery of the first tranche of funding, which was over the summer, and we're hoping that very soon we'll have details of the second tranche of funding. So I just want to spend a little bit of time talking about a couple of things that are being brought forward within Bournville in particular, and also some opportunities that we hope will be available locally over the next few months. The link there is to a Commonplace site, which is a digital engagement platform. It has been very challenging to do a great deal of consultation engagement over the last few weeks, given the timescales we've been working to and the restrictions that are in place, but we have always tried to share information wherever we can, and the Commonplace site is one way in which we've done that. And as you see, we have already had quite a number of comments through that site, and that information, that feedback is reviewed and analysed carefully and does sort of inform future developments. In terms of what we're doing within Bournville as part of the first tranche of funding is through Places for People. We're looking to bring forward, or we're just finalising basically, 2 trial measures on Oak Tree Lane and Franklin Road, which will close both of those routes to through traffic through the installation of what's called a modal filter, or basically planters and bollards that make it physically impossible to drive through, but you can still get through on foot, on bike, scooter, wheelchair, etc. And it is still possible to access either side by motor vehicle, just not through that point. Both of these locations are places that have previously been highlighted to the council as having real issues with through traffic. They both used quite commonly as cut-throughs, and there have been petitions in both of those areas previously, and also with Franklin Road around the need for safe crossing facilities, where Franklin Road meets Linden Road and Watford Road. So that's the sort of reason why we've chosen those 2 locations as the early measures, but we are sort of looking to bring this forward as part of a much broader area-wide approach in future. In terms of how this is being delivered, they are initially temporary measures. They'll be in place for a maximum 6-month trial period, and we will be keeping a very close eye on them to see how it's working. They're being delivered through an experimental traffic regulation order, and within that we do have the facility to make some tweaks or modifications to those measures. So if there is something that needs changing or adapting, then we are able to do that where necessary. But I think also we do recognise that there's a bit of a bedding in period with these sorts of things, and it won't necessarily sort of solve everything overnight, and it will take a little bit of time to bed in for people to sort of determine alternative routes that they can take, even consider alternative alternative ways of travelling. So it might be that people think as a result of this, they could look at walking, cycling for local trips, if that's an option for them. As Councillor Clements mentioned, we've got Riddy from Sustrans with us this evening. We're working closely with Sustrans on the Bournville Places for People measures, and they will be organising some pop-up events over the next few weeks, and sort of kicking off this engagement process around further measures across a wider area. And there's some details here in terms of some things that Sustrans and the council will be running with your local councillors over the next few weeks, next 2 to 3 weeks, starting with a question and answer session this Friday. And then there's also a couple of online chat and out and about walk and talks happening over the next few weeks. And then at the end of October, what Sustrans will be doing is working with local residents to plant the planters that have been installed at those 2 modal filters. And that's really to sort of encourage and support local people to take some ownership of those spaces and make sure that they really are places for people. As I said, this is seen as the sort of the start of a much wider development across the Bournville and indeed the Bournville and Cotteridge area. We're hoping as soon as we get confirmation from Department for Transport on additional funding that we'll be able to start a sort of 6-month project around creating low traffic neighbourhoods across Bournville. What we've sort of started to do already is put together a delivery plan for how that will take place over the next 6 months. Starting off by identifying the area that we're focusing on for any potential measures. Then over the next month or two, doing a lot of engagement with local residents, stakeholders, to ask people what the current issues are in the area, transport issues, parking, speeding, etc. And start to sort of come up with some ideas for what might be needed to address that. What we'll then look to do, probably in sort of about 2 to 3 months' time, is one, start consulting on any draft proposals, and the great thing with the second tranche of funding is that we will have sufficient time to do that consultation, which hasn't been possible to date with these first measures, and is far from ideal. That period will also include some potential for doing some sort of short-term trials. So it might be that if there's ideas around closing a certain road in a certain location, we could do that for 2 or 3 days as a sort of start point to see how it goes. Following on from that consultation, we'll then look to refine proposals in line with people's feedback and look to deliver the final agreed measures, again as currently on a 6-month trial basis initially, and that should hopefully happen sort of next spring, February, March time, and then straight away we'll sort of see how that's going and start looking at any further developments to again build on and extend this and look at the available resource to really sort of build this as an ongoing programme and something that can truly transform the area over the next few months and years. So hopefully there's sort of lots of opportunities for people to get involved. There's a real sort of opportunity here to transform local streets. I know from speaking to many residents that transport issues is something that every area experiences, and Bournville and Cotteridge is certainly no different. But within the transport plan and within the Places for People programme, this is something that we're looking to address, starting with a couple of early demonstration measures that are just being completed right now, but then very quickly moving on to the next stage of development. So thank you very much for your time. Hope that's been sort of useful as a bit of an overview, and I'm happy to take any questions.
Thanks very much, Joe. Yes, thank you very much. Thought that was very comprehensive and clear. He's setting out the national context and the things that apply to us in our local area. I mean, I think of this as a B30 initiative, that we've got the 2 filters, but we're moving, hopefully dependent on funding, to a wider rollout. Sorry, I just had an error message there. I don't know whether you can still hear me. Hello?
Yeah, I can hear you.
Yes,
Yeah.
yes, I can hear you, Councillor Clements.
That's fine. So at the moment, I'm not seeing any questions in the Q&A, but judging by the contacts that myself and Councillor Grindrod are getting, people do want to know about, you know, the reasons for putting in the temporary experimental filters. And Joe, you're entirely right, you know, that traffic and road safety, speeding, congestion, pollution are issues across the whole B30 area, or the bits of B29 and B31 that are also in this ward of Bournville and Cotteridge. So it's very welcome that we're at a stage where the government's priorities and the offer of extra money is aligning with what the council was proposing to do already under the Birmingham transport strategy. And I think it was important that you pointed out that the two filters that have been selected, the one on Oak Tree Lane, one on Franklin Road, they're places where residents have come together to campaign for action to try and tackle rat running and speeding. It's not, some people have asked whether it's a favouritism towards a particular road, and they've been very disappointed that other roads that are also campaigning for traffic calming or speed limit reductions, whether they've been overlooked. And it's not that. I think it's just that there was a limited amount of money, and a couple of areas had to be selected as pilots. So I think we're very much hoping that in the second round of funding that that we are successful in getting the money to roll out this approach in a wider area, and that we'll then have the time to do a comprehensive consultation and take on board everybody's issues and their views about what the scope of the low traffic neighbourhood area should be. I know that we've got Riddy with us from Sustrans, and Sustrans have been commissioned by the council to work on public engagement on this. So I don't know whether Riddy, you'd like to come in at this point and talk to us about the engagement activities that are taking place across B30.
Yes, of course. So as Joe showed you on his slide, there's a few different activities that are happening. They're all bookable through Eventbrite, and we're trying to keep them as COVID safe as possible, so limiting to smaller numbers. We've already had lots of people book, so that's lovely. They're just different ways for people to engage with the filters, have chance to ask questions in person. We're trying to find ways to encourage people to share the message about these events with perhaps those people that aren't online, that don't have the same opportunities to ask questions online. So if you know colleagues and neighbours and residents and friends that maybe haven't engaged the same way online as you all are with this event, encourage them, and perhaps if you can help them to book as well, that would be great. It's unfortunate that we have to do a booking system, and ordinarily we'd like to do lots more events where we're just out and about talking to people as we meet them, but obviously with COVID we have to be a bit more careful. There's also, as Joe mentioned, the opportunity to support with the planting. So again, do get in touch with us if that's something you want to help with. And I know that the Active Wellbeing Society, so TORS, have been doing some big street chats in some of the other locations, so in Lozells and Kings Heath, and we'd also like to do that. So hoping to do that next Monday if anybody wants to join. That'll be mostly to talk about what we can do around the filters, some potential events, but more about what we want to plant in them, and potentially any decoration that we want to do, so any painting that we want to do, or any signage that we want to put up. So looking for a constructive conversation there around how we want to, how the community want to own, as Joe mentioned, own the planters and have a little bit of say over how they look, and yeah, look positive for the neighbourhood as well.
Thanks very much, Rudy. Yes, and I think it would be really great if people had a chance to come and join in some of the activities that you're overseeing, because as Joe explained, these measures are being put in under experimental transport regulation orders. So that means that they can be put in place, and then the engagement and consultation goes alongside that. Obviously, they are experimental and they'll last for up to 6 months. So we need people's views about how they are working, and we're aware that there may be issues about transport being displaced to other roads, which I think is a major concern for lots of residents. Councillor Grindrod, you've got a question, so over to you now.
Yeah, thanks Liz, thanks Riddy, thanks Joe for that presentation. Riddy, it's great that you've been able to join us today, and I really appreciate the work that Sustrans has been doing on this. I just wondered if you could kind of give us a kind of flavour of the comments and questions that have been asked so far in the consultation, and what kind, and how we've been able to answer them. Just so, because I know that a lot of people on the call will have their own questions, and I think you guys have already kind of received a lot of those already, and I think you've got some good answers for people. I was wondering if you could kind of just give us a flavour of what's been asked so far in those consultations.
Sure. As Councillor Clements already pointed out, a lot of it's about displacement. People are concerned about where the traffic will go with just the 2 filters. But again, as Joe mentioned, it's just a flavour, it's just a start of what we want to look at. And we will be monitoring those other streets, and we want to see how the traffic behaves and then look to use that evidence to replicate it in other parts. And again, as Councillor Clements mentioned, as part of that second round, fingers crossed, of funding, we'll be looking at which areas we can work in and look at that more area wide view, but we shouldn't get ahead of ourselves. We should, as Joe mentioned, look for that bedding in period. It will inevitably change, always causes some confusion to start with, and we're not denying that might be a possibility, and that's something that I've been very honest with people about, that there'll be a little bit of bedding in period where people get used to things, and then we can look to see what that what the movements are and what happens from the filters, and hopefully it'll be positive, and we'll just continue to monitor that. So that's one of the big questions that people ask. One that Joe covered is why these 2 locations, which is that there's been existing work from the community and from residents on those 2 locations. People asking, there was a large petition from Franklin Road around a safer crossing, and this is sort of one step towards looking at how to make a safer crossing in that area. Other concerns that people are raising, again, as Councillor Clements mentioned, is why is it not my street? Again, as has been mentioned, we would like to do all the streets, and we'd like to make this Birmingham wide, but with the resources, funding and time available in the first round, we've looked at where's possible, where we've already got a little bit of knowledge, and where we've already got, in some cases, a little bit of support to try and look to see where we can have almost a quick win, as it were, and start these locations somewhere. I think, those are the sort of the main things that come up. Some people have asked, why can't we just look at one-way streets? And why do we have to have filters? Why can we not just have a one-way system? One-way streets are one method, but often create speed, increased speed, because people aren't worried about traffic coming from the opposite direction. So they're not actually the best solution to traffic, and they also don't remove any of the additional traffic. So where a filter might change a journey and keep some of that traffic on some of those main roads and stop some of that traffic from some of those residential streets that's cutting through, a one-way system wouldn't necessarily do that. So that's another question that people have sort of asked me. And again, along the consultation lines, why haven't we been consulted? This process is slightly different in that the consultation is happening throughout. So throughout this 6 months, there'll be a chance to feedback constantly, and you're not limited to doing that once. You can do it as many times as you like. Continue to feedback. It might be in the beginning that you say this is not working, and then 3 or 4 weeks later you say, actually, I'm noticing that this is working. And we need the good and the bad, so we need the good as well. So often we don't always hear when people are happy about something as much as we hear when people are not happy about something. So if it is working, you need to tell us that too, please. We need that good as well as anything that isn't working. And as again Joe mentioned, this is a trial. We have got the opportunity to adjust things if they aren't working as we initially thought after that bedding in period. So hopefully that gives you a flavour of what people have been asking us and what the questions that we've been getting through.
Thanks, Rudy. Any follow-up questions at this point, Fred?
Not for me, other than to say that there's a question appeared on about introducing a bike rail in Kings Norton Station, because there's one successfully that's been introduced. I think that's something Liz will need to take to the highways planner, or is that something that Joe perhaps can follow up for us?
Just for the sake of anyone else who's dialing in from home, and it's Andrew Nixon again who's posted this question. So that there's a bike rail on the steps down from University Station to the Canal Footpath, which makes it easier. I mean, practically that makes it easier to wheel your bike down, so you don't have to carry it. and Andrew is asking whether it would be possible to have something similar at Kings Norton Station. And can I just say, if we have got people joining us from home, please don't be shy, please post your question. I've seen another question from someone who's posting as anonymous, so if that person has got questions, please come forward and post your questions, and anyone else. But Joe, if you have a quick response on the query about the bike rail, if you can share it with us.
The wheeled ramp on University Station was put in as part of the Birmingham Cycle Revolution programme. And the idea there is to sort of increase accessibility. It's great that we've got the canals across Birmingham, but what we need is more and more points for people to get on there. In terms of putting that sort of wheeled ramp in on other locations, such as Kings Norton Station, then it's generally possible, as long as there's sort of like the resource for it. I guess with the station, it would be checking with West Midlands Trains, West Midlands Railway as the operator, but Sustrans actually run a cycle rail fund, so there is sometimes money for those sorts of improvements. But yeah, it's certainly something that can be done, and I think anything that makes it easier and more accessible for people to cycle is really important in encouraging that sort of change.
Thanks, Joe. I mean, I've got, in the absence of any questions, other questions from residents at the moment, I'd like to ask you, what you think the learning is from other places like the London Borough of Waltham Forest, but also the various, or the huge parts of the Netherlands where low traffic neighbourhoods have been in place for a lot longer. I think Waltham Forest started implementing this approach in 2015, and in Dutch cities it's over at least a decade, and I think that there is some significant evidence that it does encourage people to start thinking about how they move around and to start making decisions about choosing a different mode of transport, and particularly for short journeys, if they're able, in those other places, particularly in the Netherlands, more evidence that people are using bicycles or walking. Is that something that we can? Are those the lessons that we can draw from those other comparator places?
Yeah, I mean, I think there's plenty of evidence across the country and across the world, but even within Birmingham, in terms of these sorts of street layouts, so that there are places where roads are closed to through traffic. Within Birmingham, lots of people will live on estates, cul-de-sacs. Somewhere like Frankly Great Park was basically designed as a low traffic neighbourhood. Somewhere like Castle Vale, so it's not even sort of like unique outside of within Birmingham. But I think the learning from somewhere like Waltham Forest is that quite sort of transformational change can be achieved if you do these sorts of things, but that it does need resource. I mean, they've had millions of pounds over 5 years, and they've made incredible progress, and that's had benefits not just in terms of more people walking and cycling, but also massive health benefits. Starting to see evidence around increasing life expectancy, a lot of economic benefits, so that local businesses are seeing a sort of an uptake in takings, because it's environments where people want to spend more time and money and dwell time. So it does really have the sort of potential, not just to transform how people get about, but also livability within areas. I think one of the big learning that we've taken from the last few weeks and months is that it does take time, and to try and deliver these sorts of measures in sort of 2-3 months has been incredibly challenging for us as an authority, and also, as I mentioned, it's been far from ideal in terms of the extent to which we've been able to keep people up to date with what's happening, to seek views, to get feedback, and to involve people in the process. I think we are clear now that although we want to bring this forward, we want to allow the time to get out there and talk to people, to answer the questions and concerns that they have. And again, that's where a lot of the London schemes have been very successful, in that they have taken a few months to really engage with local residents, to go through a sort of co-production, co-design process, to hold workshops, to do street trials, all those sorts of things. So I think that's certainly something that we do want to do more of in future, and hasn't been possible over this time. But yeah, looking at how this has been done elsewhere, we're very excited about the benefits this could potentially bring to parts of Birmingham.
Thanks, Joe. I mean, one of the things that's so great about the Bournville and Cotteridge that we've got lots of independent retail, and we've got at least 2 shopping centres. And so where in the parts of London where LTNs have been adopted, is there any evidence about the impact that it has on footfall for local shops? Is it does it generally increase or decrease the number of people going out and using local shops?
Yeah, I mean, I think there's quite a lot of evidence, and it's emerging all the time, over time, as more studies are completed. I think if you improve the built environment and create, like I say, these places for people that aren't sort of dominated by through traffic, which often isn't even stopping in the area or spending any money in the area, it's just passing through, then what that means is more people are likely to visit, people will stay for longer, they'll visit more often. I know Living Streets have done a lot of research around what they call the pedestrian pound, and shows that people on foot visit more often and spend more over the course of a week. My Sustrans have done quite a lot of work around this too, and there's all sorts of evidence and case studies of more like placemaking schemes. Something they've developed in London is the healthy streets approach, and that's around making sure that people have places to sit, shade, all that sort of thing. So really improving the surrounding environment, as well as how people get around on foot, on bike, on mobility scooters, can have some real benefits for local businesses, and just make places more pleasant to be.
Thanks, Joe. And then just in terms of queries that I've received as a local councillor, some people are concerned that this could have a negative impact on access for emergency vehicles or refuse vehicles, refuse carts. Also had a few queries about the design of the filters in terms of how they work for disabled people, people with visual impairments, or people using wheelchairs. So do you have any comments about that, and how have the plans for these filters been shared or consulted upon with the emergency services and our refuse collection services in particular?
So all of those issues have been taken into account and consideration, and it has been part of the design process in terms of where the closure points are located and how they're designed. I think in terms of waste collection, we have spoken to colleagues in waste management. All of the modal filters will include a collapsible lockable bollard, and both waste collection and emergency services will have a key for a universal key for the bollards. So waste collection will pass through on their general usual routes. There'll be no changes there. They'll just open and close, and they're quite happy with that. We've had good discussions with them, that they're pleased that we're delivering it in that way, that they're confident that they can manoeuvre through these modal filters in terms of the way they've been designed and everything. So that's been taken on. As I say, emergency services will have access to the key for those bollards, but generally emergency services, obviously when they're doing an emergency response, don't want to be stopping to get out, open a bollard and carry on, because that will delay times. Generally what they prefer to do is reroute on the new available routes, and what we're doing with emergency services is making sure that they've got information on all of these road closures, that they're able to update their sat-nav systems, that they won't get directed down a road that's been closed and not be able to get through. They will be rerouting in line with that. The other thing that we're looking to do through these measures ultimately is we are looking to reduce traffic and reduce congestion, and that's one of the main ways in which we can support emergency services, because it's traffic congestion that delays them most of the time. There's been, again, from Waltham Forest, a study recently has shown that over the last 5 years, emergency service response times have actually increased. So decreased, they're responding quicker, so that there hasn't been a detrimental effect in Waltham Forest at all, and because of the reduction in traffic, they're able to respond quicker. So we will continue to liaise closely with emergency services, with waste collection, and monitor that very closely during the trial, but that has all been taken into account. And we are looking to deliver it in such a way that supports colleagues working in those areas.
Thanks, Joe. Yes, because I'm aware that there's been quite a lot of national controversy about the impacts on emergency services, and I too have seen the statistics. I think there are statistics on response time from the London Fire Brigade, and in Waltham Forest, they're able to get to the incidents more quickly because there are fewer vehicles on the road, because people haven't started to mode shift. So I think we need to be aware of what's happened in other places. Fred, Councillor Greengraw, do you have any more questions for Joe or Riddy at the moment?
I Don't for Joe and Riddy, Liz, but I do notice that Dino's got in contact with us about the question that was asked about meeting in gardens, and he's just updated us to say that he'd misread that. It should mean that we are able to meet. The rule of 6 applies to gardens, so he's clarified that for us. I know that was a question that was asked in the chat just about the previous item.
Thanks, Fred. Yes, I think I just seen that in the chat as well. So thanks for pointing that out. I think that was the question or the clarification that had been requested by the resident who's posting as anonymous. So because I'm glad that that's been clarified, because certainly that was my understanding that up until this morning at midnight or the beginning of Wednesday, I think that was the change, that you could actually start going into private gardens, whereas we hadn't been able to do that yesterday. So thanks very much for flagging up that comment and that reply from Dino. So I think if there's nothing else that Joe and add at this point, I'd like to thank them both for being with us this evening. Joe for the comprehensive presentation, and Riddy for her overview of the consultation activities so far. But just to reinforce, from our perspective, Councillor Grindrod and myself, we want everyone to have their views heard, please use the opportunities to come to some of the drop-in events, use the commonplace site to post comments, or send us emails and let us know what you think about the 2 experimental filters and the overall approach. And we do understand people's frustrations, that only 2 streets have been selected, but we are very much working on this in the hope that it will be the beginning of a much wider low traffic neighbourhood approach to trying to reduce numbers of short car journeys across our ward and make it safer to walk and cycle, and also improve the air quality in our neighbourhoods. So thanks very much, Joe and Riddy. So I think that brings us to the end of that item about the transport measures. So at this point, I'd like to invite Councillor Grindrod to give a short update, including an update from Bournville Village Trust, who supplied a written update.
Thanks, Liz, and yeah, my thanks to Joe and Riddy as well. And I think, Liz, if people have still got questions on that item, we can, they can still put them in until the meeting closes, and we'll try and get those answered for you. Yeah, so I've got a bit of an update from us as councillors, and then a bit of an update from Bournville Village Trust. So in terms of councillor updates, one of the things that Liz and I have been doing throughout the key first lockdown was bringing our community organisations together regularly to discuss what's going on, to discuss responses, what people are picking up, in terms of what's the need is in the community and how we can respond to that. And I'm just so grateful to all those community organisations that joined us for that, and that played such a role in sustaining our community through those difficult times. We're still doing that meeting. It's going to be roughly every 3 to 4 weeks. And if you're not involved in that at the moment but would like to be involved in that meeting, then please do email us and let us know. We'll make sure you're added to that list and can join us for that community call. The other thing that I've been doing recently with the highways engineer, so we've been going around, so the highways engineer is kind of looks and repairs all the highways, land, the pavements, the roads and everything. We've been doing walks around at various points every fortnight around the ward, walking down streets, looking at any problems, recording those problems and logging them to get fixed. If you'd like your street to be walked by us, or maybe whilst respecting the rules, the restrictions, would like to talk to us about a particular problem in your street, then do get in contact, and we'd be delighted to hear from you and to get out there and have a look at that. And the other thing I think, Liz, is that we haven't been able to have ward surgeries in the same way that we had prior to lockdown. We are contactable via our email address and our phone numbers as advertised on the council website. But I think we'll continue to look into how that's possible going forward, obviously recognising the current restrictions. So, Liz, you mentioned I've got an update from Bournville Village Trust that they've sent through. Quite a long update, so I think we'll try and see if we can share this with everyone on the call. Next, when we've got that through.
I think it's been emailed round. I think Kay, can you confirm that, Kay?
Yes, I have, councillors. I emailed it round to everybody on the mailing list yesterday.
Well, so thanks, Kay. So obviously everyone.
Just have the highlights then, Fred.
Yeah. So obviously, people who live in the Bournville Village Trust area will be aware of the design guide consultations that have been going on through this year. There's an update on that and what BVT's plans are to continue to listen to residents and to revamp the design guide to make it a design guide for the 21st century, so they do keep an eye out on that if you live in the Bournville Village Trust area, because that's going to be a really important document going forward. BVT are still obviously able to support their tenants and residents around welfare needs with regard to the current crisis. So please, there's some numbers on there that you can get in contact with them on. Their repairs staff have been working very hard to get through the backlog of routine repairs, but again, they're working on that. So do get in contact with them if you feel that your repairs that you're waiting for haven't been, you're still waiting on that. And they note that antisocial behaviour complaints from residents in Bournville remain relatively low and steady, but they are working with the local policing team on that. And the Trust have now signed up to a noise app that allows residents to make immediate recordings of noise on their phones and send the recordings directly to us. So do look out for that as well, because that certainly sounds an interesting development there. I know that we've had a number of residents and contacted me about noise issues. And then finally, Selly Manor are doing a Capturing Stories project as part of the Bournville Heritage Online work around what's happened during the pandemic. So they're really keen to hear local community stories that they can capture so that we can remember all that happened during those difficult and terrible times indeed for many people. So please do have a look at that if you've got a story you'd like to tell or would like to be heard. Thanks, Liz. That's my update for now. And if there are any questions, I'm happy to take them.
Fred, was there just something, could you just flag up what it says about the I know it's perhaps early in the season, but what it says about Christmas in Bournville, because I think there will be some changes just in the light of the situation, but still plans for a great Christmas.
You're right, Liz. There's another page there that I didn't scan quickly enough. Yeah, Christmas in Bournville 2020. So some important announcements here. Bournville Christmas Festival, including the traditional switch on of the iconic Christmas tree, is going to be reimagined this year in response to the restrictions. So they're not going to be hosting the usual festivities on and around the green, but there will still be celebrations both for the switch on and throughout the month of December. This year's festival, there's going to be an online event that they're looking to make as lively and interactive as possible. There's going to be a website they're going to launch in late November to showcase a Bournville Christmas Festival 2020, and so do keep a watch out for that. So they think there's going to be a lot of virtual switching on lights virtually and joining people there, so that do keep an eye out for that. Saturday the 28th of November at 2 p.m. They're going to launch this website, which will include all the details of what they're going to do over the month of December, including obviously how to respond to the what we can and can't do during that time. Thanks, Liz.
Thanks, Fred. Yeah, very good to get that update from colleagues at BVT, and I think BVT's played a really important role supporting other organisations and community groups throughout the pandemic, and I think they're very keen to emphasise in their update to us that a lot of their advice services are available to residents who are not tenants or residents of the BVT itself. So they've got a wider reach. And as I said at the beginning, the brilliant thing during this terrible pandemic period has been to see the response of our community and charities and residents organisations and community groups. So it's, in a way, it's unfair to single out one or two organisations, but I just want to say how impressed I think both of us as councillors have been by the Tending to Cotteridge group, which has been making real leaps forward in improving the look and the feel of Cotteridge Centre. I think you'll have seen the planters and the revamped bench outside the post office depot in Cotteridge, and the signs and the bins for cigarette stubs, and also I know that Lucy Sobrero and all her volunteers have been talking to the traders and helping them to look at how they can improve the environment too. So that sort of community activity is really brilliant for our communities. And I also heard today there that Cotteridge Park has retained its green flag status as well. So again, all of those things that like our parks and the friends groups that support parks are so important and make us realise and what a good quality of life people are mostly having in our area. So that's been great to see while we've gone through this really difficult period. And as Fred has said, we can't hold at the moment the normal advice surgeries, but this is really just to urge people to come to us, contact us by phone or email if you need help with anything. We spent a lot of time during the pandemic trying to help people access food if they were sheltering, or if they're in becoming into economic needs. We've helped a lot of businesses access grants to keep them going, which the grants that have been processed by the City Council, and obviously with people with ongoing housing needs. So please make use of us. We're there to help you access council services, but also and help you sort out any other problems that we can. We'll always try and do what we can, and the same applies obviously to Steve McCabe, the local MP. At the moment, I'm not seeing any other questions from residents joining us from home. Fred, is there anything else that you want to raise at this stage?
Not at this stage, Liz, but I do. Yeah, I was going to raise the Cotteridge Park thing. That was a great achievement by everyone involved in Cotteridge Park in getting that Green Flag Award today. So well done to involved. Yeah, no, I think that I can't see any questions either, Liz, but I do think if anybody does have any questions following any of the items, do get in contact with us, and we'll get you answers to those.
Thanks very much, Fred. So in the absence of any further questions, I'm going to close the meeting now, and just with a reminder that the meeting has been recorded, so there will be a record of it via that recording that will be made available. Kay has sent round the update note from Bournville Village Trust to everyone who's on the mailing list for the ward forums, and if anyone wants to see the action notes from the March meeting, which was our last face-to-face meeting, Kay can also send you those. So I'd like to thank everyone who's participated tonight. So Dino for the public health update on COVID, Joe and Rudy for the update on the experimental filters and the work to develop a low traffic neighbourhood, and Kay for supporting the meeting and very efficiently as she always does, and Fred for his contributions. So thank you very much, everybody, and it looks in the foreseeable future that we'll have to continue meeting via this online format. So we'll hopefully be aiming at a meeting every quarter as we have in the past. So look out for future invitations to the next ward forum. Thanks very much for being with us tonight, and goodbye.
Thanks, everyone.